patient presents with three symptoms: benign acute childhood myositis, Kawasaki disease, and staphylococcal enteritis.
Based on these symptoms, it could be Kawasaki disease or staphylococcal enteritis.
Before we discuss this further, can we at least confirm the patient's age before we find out you pulled benign acute childhood myositis out of your ass?
For all we know, Leslie, the patient is a Redditor. It's highly likely they have benign acute childhood myositis.
But what about malignant acute childhood myositis? That could be a possibility as well.
I agree. We should consider all possibilities before jumping to a conclusion, except for Frank's.
You're all wrong. The correct diagnosis is uveal melanoma.
But that's a type of cancer in the eye, not related to the symptoms mentioned.
Are you sure about this, Hawks? It doesn't seem to fit.
Is uveal melanoma even treatable with radical mastectomy?
I don't give a damn what you all think. We're going with radical mastectomy. It's risky, but it's the only way to save the patient's life.
Oh, for God's sake, we just did radical mastectomy.
The patient is different this time.
And so are the symptoms. Now, save their life, damn it.
Tracy, I need to talk to you about my patient. I really believe we should perform a radical mastectomy on her. She has uveal melanoma, and it's the best course of action.
Uveal melanoma. Radical mastectomy. I can't solve for X here, Hawks. Why do you think it's the appropriate treatment?
Unlike you, I spent 23 years in medical school.
That is not the flex you think it is.
Whatever. I've got a patient to save. I don't have time for doubters.
I just checked the patient's vitals. It seems like she's in critical condition.
That's not good. I have a feeling the radical mastectomy might not have been the right treatment for her uveal melanoma.
I remember Dr. Hawks being so adamant about it. But now that you mention it, it does seem like an aggressive approach. What do you think would be the best course of action now?
I believe we should start her on some targeted therapy and maybe consider radiation as well. We need to act swiftly.
For once, I somewhat agree.
What the hell were you thinking? Uveal melanoma. Radical mastectomy. You nearly killed our patient with such incompetence.
We thought we were doing the right thing. What do you think the diagnosis is then, Hawks?
You lot don't deserve to know. You're a disgrace to this hospital. I'll figure it out myself. Just stay out of my way.
Oh, spare us with that shit. We told you this wouldn't go well.
At least some of us care about helping the patient.
Help. You call microwaving the patient into a crisp help? If I wanted something radiated but on a grade of fuck my shit up, I'd ask the goddamn cafeteria to microwave scallops wrapped in tin foil.
Come on, Hawks. Give us a chance. We can learn from this mistake.
Learn. You're all beyond help. I'm done with this nonsense. Figure it out yourselves. I won't be dragged down by your incompetence any longer.
Gary, did you do targeted radiation or global?
I don't remember.
There's no hell hotter than what the patient is going through. And even that wouldn't be hot enough for you.
So, Johnson, how are things going over in oncology department?
Pretty good, actually. We had a successful round of treatments with some of my patients. Seeing progress is always uplifting.
Sounds like for once your patients are having a better day than mine. Which now hearing that, I think I solved it.
Really? What was the breakthrough?
It turns out it was a rare autoimmune disorder causing all the symptoms. I can't believe I missed it before. I need to go check on the patient right away.
Oh, okay then. Well, good job on figuring it out, Hawks. I'll see you around, I guess.
Sorry I'm late, folks. We've got a situation here.
Hawks, where's your protective gear? You can't just barge in here like that.
Where's your tinfoil hat?
This is unacceptable, Hawks. You're putting everyone at risk.
Oh, doesn't that suck? Well, whatever immune system the patient had, Gary gave it the Chernobyl treatment.
What's going on, Hawks? You're not making any sense.
Did you even wash your hands before coming in here, Hawks?
Forget about uveal melanoma. That was a misdiagnosis. It's aphalia. Diagnosed it with Dr. Johnson over lunch.
Aphalia? What's the prognosis, Hawks?
Prognosis is simple. We operate immediately. It's a matter of life and death. And Gary, you're done for the rest of the day. Get the hell out of here. I can't believe my idiots 3.5 made such a mistake with the diagnosis, Tracy. I feel terrible.
Who's the half?
Don't be fresh. You know full well who I'm talking about and why.
Yeah, for once I'm starting to see what's wrong with your department.
We need to get rid of Gary. The patient is lucky to be alive. Then again, maybe not after what they went through today.
If the patient and all their power of attorney signs off on it, Gary will be kicked out of here.
No, we should fire him right now. I'm so sick of his idiocy.
That won't look good for you in the investigation.
How? Just how? Keeping him a minute longer will result in someone's death. I guarantee it.
He so far has a better track record of living patients than you and Frank.
Don't you dare compare me to that clown. I'm out for the day.